Hi, I'm Karen Perkins and I'm a clinical scientist and I work in a blood sciences laboratory, and I'd like to show you around a little bit what happens in the lab when you have your blood test taken and what happens while you're having your blood taken. Your blood test is really useful for a clinical decision. There's about 60 to 70% of clinical decisions involve a blood test result. You might be responding differently to certain types of medication. You might need your dose changing. You might have symptoms that have come on all of a sudden and the doctor's not sure what's wrong. So we want to check and see which body system might be involved in that. You might be a diabetic and you need your blood glucose or your HbA1c testing, or you might have some hormonal changes that you're not sure about. So it's vital that we get a good quality sample from you and we get it to the lab as quickly as possible and take those measurements straight away. When you come in for your blood test, you might have been asked to prepare for that blood test before you come in. So you might have been asked by your doctor to stop taking certain medications so we can get a good baseline reading of what's really going on in your body. You might have been asked to not take certain food types before you come in as well. So certain things can stimulate your body to produce certain molecules that we might be trying to measure. And again, we want to get a nice baseline assessment of what's going on. You might be asked to not take vitamins. Certain vitamins off the shelf can interfere with some of the measurements we try and make in the laboratory and can give false readings. So it's important that you speak with your doctor first and make sure you understand what you need to do before you come in. You might notice when you go into a phlebotomy clinic or a doctor's surgery, there's lots of different blood tubes on the shelf. They all look kind of the same, but they've got different coloured tops or different coloured labels to them. And the person who's taking your blood sample may take a selection of different coloured tube tops. Those tubes have lots of different things inside them, different preservatives, different chemicals to stop the blood from clotting together so we can measure different things in there. Most blood tests are taken from the elbow area here. And that's a very common place. For most people, it's not a painful process at all. You maybe feel a slight skin prick, but for some people, it can be a very stressful process and fearful. And they will work with you as best they can here to make sure it's a comfortable procedure for you. If you're needle phobic or you really struggle with a venipuncture and it's a terrifying, painful experience for you, there are other ways of accessing a blood test. You may not have been able to give a blood test for a few years because the perception of doing that is a terrifying thing for you. And this happens especially with patients with learning disabilities. There are other ways of accessing a blood test, and these can be done through the upper arm using a capillary collection device. And this can be used anywhere that's comfortable for the patient. You can do it in your own home, you could do it in your GP practice and drop it off at the laboratory or the GP practice. You can take your own blood sample in the comfort of your home. This might be best suited to you if you are living in a remote location or struggle to get to a central healthcare facility for a phlebotomy appointment. Or you might just be too busy working and can't take time off, or you need to care for younger or older relatives, and this makes looking after yourself a bit harder. Some services might offer a postal service, so you can return your sample easily by dropping it off in a post box. Not all labs can do this, as ensuring the sample does not degrade over time is an essential part of the laboratory process, so we can provide accurate results for you. Once you've had your blood sample taken, the sample then needs to get to the laboratory. So it either comes through the post or by a van collection from your GP surgery, or it comes direct from the wards into the laboratory. The sample has a little barcode on it, and that barcode has a whole load of information on it. So it has your name, your address, it links to your patient record, it will tell us which samples, which tests you've had previously, and it will tell us which tests are being requested on that particular sample there and then. So these are scanned into the lab at reception, and then they're put into a rack and they go through to be centrifuged. So not many people realise, but in biochemistry, we like to look at the golden liquid on top. So we'll centrifuge these samples and spin them down so that the red blood cells will sit on the bottom of the tube and the golden serum or plasma sits on the top. And it's this fraction that we're interested in. This is where we can measure your blood biochemistry and find out what might be wrong with you. Once we've separated out the serum that we want to test, the sample then goes on to our automated analyzers. We use a lot of robotics in our laboratory. We have different analyzers that will measure what we call general chemistry. So it's the bread and butter of diagnostics. Like I said, your liver function, your kidney function, general health, bone metabolism, those kind of things. And then we have other automated robotic platforms that will look at more sensitive measures, maybe like your thyroid function. If you're on thyroxine, you'd need regular testing for that. Reproductive hormones, testosterone, and some of the vitamins as well. Some things that are quite tricky to measure. Vitamin D, for example, B12 and folate. A lot of people are monitoring those at the moment. And they all come through our laboratory here at Blood Sciences. Once we've done the analysis in the lab and we're happy to send the results out to the GP, the GP or the doctor or requesting clinician will review those results. If there's anything really, really wrong, we have critical limits in the laboratory. So we know when somebody's really poorly, we need to get that result out urgently, and it will be telephoned to the doctor and they will contact you accordingly, and you'll be reviewed straight away or as soon as possible if it's really serious. No news is usually good news. If you're at all worried, then call your practice or your clinician and find out where your results are. But we usually turn around biochemistry results within 24 to 48 hours, so your results should always be there in your patient record as soon as possible. If you're unsure about anything, you must always ask. Your doctor or nurse or the phlebotomist might be able to help you straight away with that. Just remember, it's your body and it's your blood test. You're in charge of that and it's your information. Don't be afraid to ask.